Hi, Scott Proscia, performance coach at iRep Athletics and author at the Training Plan Source. We're going to talk about runner's knee, and this is kind of a catch-all term, very loose, loosey-goosey term for my knee hurts when I run. A lot of different problems here. I just want to review a little bit of the anatomy of what can be involved and point you towards one of our injury management plans that may help you mitigate your pain associated with running. So we have our upper leg bone called our femur, we have our kneecap, and then we have our lower leg. All right. On this medial side, we have a muscle called the vastus medialis, and then we have a little part here called the VMO, which is tends to be often underdeveloped or underutilized, especially if somebody's had any type of surgery before. They have a hard time kind of activating this muscle again. We have the vastus intermedius, which is a muscle that's deep, running down the center, with the rectus femoris over that. And on this outside, we have the vastus lateralis. So this makes up our quadricep group, and usually what happens is, I already mentioned, this muscle's a little bit weak. This muscle tends to be stronger than the medial side and tight, and we kind of get in a tug of war with our patella. So our kneecap kind of ends up not riding in this groove perfectly. So on our femur, we have a groove that it sits in, and we may see that it's kind of tilted. We may see that it's shifted. We may see that it's riding high or riding low. We have some, patella baja, and we can get into all these technical terms, but our patella alignment may not be 100% correct. If we were able to do a clinical diagnosis on you, we may be able to do like a McConnell taping or something to help put that kneecap in a better position. But we're not your athletic trainers, we're not your physical therapists, we're not your doctors. We do encourage you to go, get a real medical diagnosis from them. We simply want to tell you about some of the current injury management strategies for this injury. So really what we're doing is we're working on some mobility of the knee. All right, so we're stretching. And when we're talking about stretching, we're not just talking about, grab and hold it 10 seconds, 30 seconds. We're talking several minutes. And when we see somebody in physical therapy or in the athletic training room, about 80% of their time is devoted towards mobility and stretching. So research shows that 20 minutes per day per joint is needed and required to increase serial sarcomere so we can actually start changing the length of this muscle. And start really getting some gains from our time stretching. So we need to spend a significant amount of time. So there's going to be a lot of mobility work that can help in an injury management strategy for runner's knee, and also some strengthening to kind of balance out these muscle groups and get our hamstrings and our quadriceps all equally balanced so that we get efficient dynamics of this kneecap and efficient dynamics of this knee, so that it will reduce our risk of injury. So if you want to learn more, we're going to have you go to thetrainingplansource.com. Coach Anthony Ross, our head strength and conditioning coach, has put together a great program that kind of outlines some exercises that are traditionally done with management of this with this condition, and that's at thetrainingplansource.com.